In our practice, we do quite a bit of SMP or scalp micropigmentation. The majority of SMP done out in this world is done for patients by oftentimes good clinics, if they're properly chosen, that are doing the SMP to restore heads of hair so patients can shave their heads, or they will shave their heads, and they don't look like they're bald. That's definitely a valuable or an invaluable role of SMP, because it lets these guys that shave their head that are balding look like they're shaving their head simply because they want to just have a buzz cut. We primarily use SMP to complement the results of either hair transplantation and or medical therapy, because most of our patients that are getting SMP, they're actually looking to make their existing hair look fuller. And the way SMP works is basically it creates tiny little dots that mimic what a very short hair follicle as it's emerging from the scalp would look like, so it can probably come close to doubling the appearance of density in a patient with thinning. And the nice thing about SMP is the results are immediate, it's painless, and it lasts for 5 years, more or less. Done properly, the color dyes, that's all, we specialize in matching the color, and we usually do it over 2 or even 3 procedures to make sure we get just the right color, pattern, and outcome. But the nice thing, once again, about SMP is that because it's temporary, if in 5 years the patient says, you know what, I don't want to, I don't really care anymore, and or if a patient's hair becomes gray and they're concerned about, there being dark dots, that's not relevant, simply because the dye is going to fade away.